Let's go ahead and talk about risks because there's no surgery without risks. And so the risks of BBL, we already talked about the little scars that you're going to have. There's always a risk that those scars don't heal very well, which is very rare but can happen. If you have any risk of or history of hypertrophic or keloid scars, make sure to let me know so that we know of things that we can do to help prevent that. Additionally, you're not perfectly symmetric now. You may not be perfectly symmetric afterwards. So just know that going in. The way that we do liposuction and BBL is we take a long skinny cannula and we have to pass it underneath your skin over and over again thousands of times. And so you can kind of understand that getting everything 100% perfectly symmetric is almost impossible. And so with that also being said, you may have a little bit of contour deformities. So we try not to make too many lumpy bumpies, but every once in a while people will have a little bit of a lump, how their skin kind of heals down, maybe a little bit asymmetric from one side to the other. So part of that is the surgery, part of that's just how you heal. And so not everything is going to be perfect, but just going into it knowing that there are limitations of surgery kind of helps get your mindset ready for that. Absolutely, you're gonna look better. I wouldn't be doing the surgery if you wouldn't, but we just need to make sure that we have realistic expectations going into it. The other biggest risk with a BBL is you don't want anything called a fat embolism, where fat gets injected into the deeper structures. That is the most dangerous thing, and that's why BBLs can be dangerous. Dr. Weijie and I both perform this in an extremely safe manner. We are very conservative and we only inject fat in the subcutaneous area. We do not penetrate into the deeper muscle areas like that. Now, injecting fat in those deeper structures can give you more of that bubble butt type of look, but your life is just not worth it. We're not going to do something that's dangerous. Additionally, you may have some fluid that can collect afterwards. You may have a seroma that we need to drain. That does happen very rarely on occasion, but that's also one of the risks that we do run into.